Hello, everyone, and welcome to part two of our lecture on legal aspects of health insurance and reimbursement for our healthcare settings, claims cycle, and claims processing class. I'm Ms. Blair, and I'm going to take us through our lecture today. So, what are we going to deal with in legal aspects? We are going to talk about HIPAA, which is Health Insurance Portability and Accountability Act. So let's talk about it. It's not a hippo, okay? It's HIPAA. It's one P and two A's. When you're writing and spelling it, please make sure that you use one P and two A's. Every healthcare professional must know how to spell HIPAA correctly, okay? We're going to talk about it, titles one and two, and we may get to three. I'm not sure. Okay. So, what is HIPAA? Let's see if we know what it is. Well, HIPAA is a very in depth and large law. It has five titles. The first title is Healthcare Access, Portability, and Renewability. The second title has three areas: preventing healthcare fraud and abuse, administrative simplification, medical liability reform. Title 3 is tax related health provisions. Title 4 is application and enforcement of group health plan requirements. And number 5 is revenue offsets. Now let's back up a little bit to Title 2. Title 2, administrative simplification, has three subsections: privacy, security, and EDI, electronic data interchange. And then under that, there's three more subsections, if you want to call it that. Okay. And those are transactions, code sets, identifiers, and bears. Oh my. We'll get to all of that. We are really going to learn a lot about HIPAA, but we're not going to dive deep into it because it is a lot of information. But of course, you have your textbooks and you can always go in and take a look. So, what is HIPAA? In 1996, which is a little while ago, Congress passed that law because they were concerned about fraud. So, HIPAA, the law, covers all federal and state health insurance programs. It's a federal legislation. It improved the portability and continuity of health insurance coverage in group and individual markets. So, if a person lost their job, now they would be able to buy insurance that would keep them covered while they were looking for another job. They would not just be without insurance. There would be something at Gap or something like Cobra, they call it now. Um, they could move their insurance from one job to another job. That's why we call it portability. They can port it. Of course, we talked about waste, fraud, and abuse. Remember what fraud is: when a person knowingly and willingly does something to deceive the health insurer so that they get monies that they do not earn. Okay. It created standards for electronic health information transactions. So, like health information claims, right? Or health claims, right? Electronic claim systems. Now we use electronic claim systems. And there has to be standards, meaning everyone has to do it the same way. And then we created privacy standards for health information under HIPAA. All right, so here again are five titles. And we definitely, when we are talking about billing and coding or HCA, we talk about Title II a lot, okay? And we're going to talk about why that is. You'll see some of the subjects and understand why that is. All right, so With Title I, the access affordability area, we limited exclusions for pre-existing medical conditions. So prior to HIPAA, what could happen is if a person applied for health insurance and they had a pre-existing medical condition, the insurer could just automatically say, no, we're not covering you. A medical condition that was pre-existing, it could be something simple as asthma, it could be bronchitis. It doesn't have to be something like cancer or hip replacement. That's a pre-existing condition. Even a surgery is a pre-existing condition. Most people have a pre-existing condition. So it helped us as patients when we went to get health insurance. Okay, it provided credit for prior health coverage. It gave us rights that allowed us the ability to change our coverage for life events. So if in the middle of the health year we had a baby, we could add our baby as soon as we had the baby. We didn't have to wait till enrollment came around. Okay? It prohibited discrimination in the enrollment and premiums against employees based on our health status. So if an employee prior to HIPAA was not in the best of health, an employer could discriminate and say, okay, we're going to give you a much, much higher premium than the person sitting next to you because you have a health status that is not as well as the person sitting next to you. Well, they can't do that now. When the employer gives out or says this is what the premium is, it's just based on what is offered. And everybody has the same premium. Single people have one premium based on the plan, and families have one premium based on whatever plan they choose. So it really helped the patient quite a lot. So Title II, quite a bit um, seriousness in Title II that we really, really need to know about. The fraud. Okay, so one thing you have to know about fraud, even if what the person does is not successful, like they don't get any money, the attempt itself is still fraud. So they still can be brought up for against charges. Like we saw in the last lecture where the Department of Justice has their heat strike force team and they may have someone go in undercover um, and so they stop the person or the provider from actually getting the money, but because the provider actually attempted to commit fraud, they still can be charged criminally. So, abuse and fraud, the difference is the intent. However, both of them, steal resources. Okay. With Medicare fraud, you can have penalties. Criminal, that means you can go to jail. Civil, you may have to pay money, or sanctions, meaning there could be some limitations placed on the provider. So what else happens in Title II? Administrative simplification. What is that? Okay. So there's some standards. How are we supposed to maintain health information? How are we supposed to move health information back and forth um, about our patients? There's a lot of information that we are responsible for. So what do we have to do? We have to standardize so that everybody has to do it the same way. We have to standardize how we move the electronic data back and forth. We have to protect the security and the confidentiality of electronic health information. Okay. So when HIPAA was coming into the world, let's say it was being born in 1996, we were just getting into electronic health information, trying to put our toes in the water and figure this thing out. Um, we had to comply with this HIPAA law. That's what it said. We must do that. And HIPAA said there has to be a uniform language. Okay. Just like medical terminology is a uniform language. So if one doctor speaks to another doctor, they speak in medical terminology so that they understand what they're saying. Everybody knows what each other is saying. It's a language. So basically, it says, hey, this is how everyone has to do it. And it deals with the electronic data and how it is moved from place to place. What else do we deal with in Title II? Confidentiality. So we don't want just anybody being able to get to a patient's health information, right? So what does confidentiality mean? It means we have to restrict the access to the information only to those people with the proper authorization and those that maintain the security of the information. So, not everyone has to have authorization to all information. If you are a coder and you need to get to the patient's medical records in the electronic system, then that's all you're going to be authorized to get to. You won't need to get to the patient's financial records. You just won't. Um, when we restrict access, that's done through the IT department. So part of confidentiality and restricting access deals with security. How do we secure the patient's information? Well, we can have passwords for electronic information. Okay. Right now, a lot of things aren't hard copy, but when we had hard copy, they had to be in a locked room where only certain people had access, whether it was a key or whether it was a keypad. Okay. We also had to have to protect the information. That can't be altered, it can't be destroyed, it can't be tampered with, we can't lose it. So how do we do that? We have to have policies, right? Remember from our last lecture, we have to have record retention. So it's for 6 years. So we have to know where the records are. We can't have an altered record because it's a legal document. So we also have to train employees about confidentiality. How do we do that? We can have annual in services. And we can have to have employees sign a confidentiality statement saying, I'm not going to tell anyone about what I see. Because when you log into the system every morning, it knows that Stephanie Blair signed in at 8:05 a.m. It knows what record Stephanie looked at. It knows what time she looked at. It knows what she did with it. It knows if she added something to it, if she subtracted something from it. It knows everything that you did. And if you're not supposed to be in that record because it doesn't have anything to do with what you're doing that day, um, somebody's going to want to know why you were in that record. And if you don't have a good reason, there's going to be a little bit of a problem. So, what else does Title II do for us? Well, it describes the breach of confidentiality. What is confidentiality? Remember, we keep we restrict access to patient information. So, if we release patient information to a third party and is unauthorized, these are some of the ways that it could be a breach. And you wouldn't even think that these could be a breach. But listen to this. If you discuss a patient in public places, like an elevator or at the lunchroom table, you can't do that. Okay? If you leave a patient's information unattended, you have it up on the computer screen and you need to excuse yourself for the restroom and you don't, put your screensaver up. Anyone walking by can see your screen. Now, you could say, well, we're all billers and coders. Well, maintenance can come through, housekeeping can come through. They have no business seeing that information. Okay. If you communicate to family members without the patient's consent, I was in the hospital. Now they ask you for a code word. If someone calls the hospital and says um, to the floor and says to the nurse, I would like to speak to Stephanie Blair. And if you don't have a code word, they don't even tell them that Stephanie Blair is in the hospital, okay? Because just letting them know you're in the hospital is a breach. If you haven't given your consent is the code word. If you announce patient information in the waiting room or in the registration area, so if you are in the registration area with a patient and you say your urinalysis test is negative, you can't. That is a breach of confidentiality. And like I said, if you go into patient information without job related reason, you decide you want to look up your neighbor's medical record, and you don't have a reason to go into that, that's going to be a problem. So there's something called privacy. We all say we have a right to privacy, but do we know what that is? It's different from confidentiality. Confidentiality is keeping somebody's information from being accessed. Privacy says I have the right to keep my information from somebody else. Okay, I have the right to keep it secret. And so the information that I have the right to keep secret is protected health information. And that information is something that can identify me, my name, my address, my telephone number. Well, you would say, well, how would a telephone number um, identify me? With a telephone number, someone could go backwards and find out who that number belongs to. Date of birth, Medicaid ID number is just a number. But if you have the right person that can go and find out whose ID number that is, they can find out that it's me. Medical record number, it's just a number, but that number can be traced back to the patient. Social security number, name of employer. There's quite a number of things that can be traced back to an individual. Okay, even an address doesn't have to have a name, but if I have an address, I can even go and go to that address and sit outside and look to see who goes in and out of that house. Um, so the provider or a payer or a third party um, should get the individual's authorization before they disclose their information to someone. Okay. And there's an authorization form that has to be um, signed by the patient. Now, there are reasons when a provider does not have to have authorization from the patient to um, give out protected health information. Um, and it's called TPO, Treatment, Payment, and Healthcare Operations. So whenever the provider is submitting a claim to the health insurer, they don't have to get authorization because the claim has all that information, that PHI on it. So they don't have to get the patient's authorization every single time they send in a claim. And HIPAA says they don't have to do that. HIPAA also says that if a patient has a certain particular disease that has to be um, told to the health department, that they can tell the health department, but they don't have to tell who it is. That depends on the disease. Um, if the police come and they want to get access to the patient's information for maybe something criminal, then they don't have to get authorization. So all of those particular things are in your textbook. So also in HIPAA, the code sets were mandated. And what are our code sets? Our code sets are what are the manuals that we use to determine the codes. The dental services are used, the CDT. Our diagnosis, we use ICD-10, CM. Our hospital services are the ICD-10 PCS, which I didn't put on the slide, but you all know that already. Physician services are the CPT. Well, right here you see hospital inpatient on ICD-10 PCS. Pharmacy transactions are HCPCS. Remember that? And something else that's new, um, when you have a prescription and you get a prescription filled, that um, transaction has to be billed to your insurance company. And each and every drug has what's called a drug code. And it's a unique 11-digit number, which you all don't have to worry about because we don't bill for it. It's pharmacy. That has to be used to report the billing of the prescription of the drug that was uh, prescribed for you. So there's quite a bit more to Title One and Title Two, but these are the most important. I think that covers what we do in our class. Okay, so it's time to wrap it up. Okay. Um, Chapter 5 is where you can read more about HIPAA. I want you to make sure you do your assignments. Get help if you need it. Call tech support. Um, I want you to make sure that you are in attendance at our next lecture, and I will see you then. And until then, please take care. Bye bye.